Hey, you guys, I'm going to see if I can do this in one take and just do it really quick because I had this thought. This is a certification debate follow up. And before I talked about how you don't have to be certified, right? And now I am going to give you 10 reasons why you may not want to be certified, why it might not be in your favor. And what brought this on is a remembrance I had many, many years ago. I was actually hired as a legal expert in a case where a nurse practitioner used a Dremel grinder with a sandpaper bit, and anyway, the foot ended up getting amputated, and after many difficulties. But somehow during that time, I found out that, say you're working as a registered nurse, but you are also licensed as a doctor or nurse practitioner, whatever it is, I found out that you are actually held for responsibility for the highest licensure that you possess, even though you may not be working under that licensure, what seems crazy. But anyway, that's what got me thinking about this whole issue. And because I don't want the responsibility of, at my age, at 72, of keeping up with the medicines of what in medicine, a foot person, which ones to look out for. I don't do the whole assessment thing. I don't do ABIs. I just refer them to their regular doctors. My scope for what my services are horrible, the worst, terrible corns, calluses, resurfacing the foot, maybe some foot care, hygiene, education. I'll give some referrals about shoes, but I tell people I don't know really what's out there, but and I make that very clear that that's my scope. If I was certified, it might be a whole different ballgame. So what I'm going to say now is 10 reasons you may not want to be certified. Number 1, certification expands your scope and your liability. Certification signals to clients, regulators, and insurers that you can assess, diagnose, I don't think that that's actually true, but and treat more complex conditions. But if all you want to do is basic, comfort-focused foot care, the more responsibility and the more legal exposure, that's more responsibility and more legal exposure than you might want. You don't need it to work independently. In most states, including California, licensed RNs can provide foot care without certification, as long as you stay within the scope of practice using great technique and know when to refer. Number 3, it doesn't match the simplicity of your service. If you're focused on hygiene, toenail trimming, and comfort, not managing wounds, infections, or vascular disease, then certification might set expectations you don't want to fulfill. Number 4, it can be costly and bureaucratic. That's probably my number 1, but certification involves fees, continuing education, renewal requirements, all designed for clinical hospital settings. For independent nurses, that time and money may be better spent elsewhere. You betcha. And number 5, it can create misalignment with your clients. When clients see certified, they expect a higher level of service, wound care, assessments, medical interventions. Actually, I've never found that to be true, but this is what this one resource or source I'm quoting says. If you're not offering that, you may find yourself constantly managing expectations. Number 6, it's not required by law. No state mandates foot care certification for nurses providing routine foot care. Let me say that again. It's not a legal requirement. Certification is optional and sometimes unnecessary. Number 7, many great nurses work without it. I know because, I had it write the script. I know because I'm one of them, yes. And I've worked with and trained hundreds of foot care nurses over the years. You can be ethical, safe, incredibly effective without jumping through all the certification hoops. Number 8, it might limit your creativity. When you're certified, you might feel boxed in by clinical guidelines, but when you're working in the community with seniors and the underserved groups, you need flexibility, patience, and human connection more than clinical protocols. Number 9, you just want to help, not diagnose. If you're not trying to manage infections or do advanced cardiovascular assessments and your goal is to keep people clean, comfortable, and mobile, you're already doing valuable ethical work. And number 10, referral is your superpower. Not being certified doesn't mean you're careless. It means you know when to refer up. Being a great foot care nurse often means knowing your limits and handing things off when needed. So if you're an RN who just wants to trim nails, I say just, I mean, the stuff that I'm doing anyway is pretty profound. It's almost like a foot transplant or something by the time you see the before and afters of the most extreme stuff that I do. But even if not, even if you're just doing long, nails or whatever, it's your business. You do what you do best, and that's good enough. So let's see. So stay safe, stay clean, and keep lifting people up 1 foot at a time. So that's my 2 cents worth today, and pass this on to anybody you know who is questioning about this. All right. Have a good one. Bye.